Today we'll be discussing about systemic fluorides, wherein I'll be discussing in elaborate form about the various modalities of systemic fluoride administration like water fluoridation, salt fluoridation, milk fluoridation and fluoride tablet delivery systems. We'll be also discussing about defluoridation and fluoride toxicity. So, as we all know that the greatest contribution towards the anti-caries effect or the prevention of caries in dentistry has been done since the discovery of the fluoride element, and it's used as an anti-caries measure. And moreover, it is an element which is included in the preventive dentistry. So fluoride is a remarkable element. It is widely distributed in atmosphere, lithosphere, biosphere and all over universe. It is a highly electronegative element which is only present in salt form. It cannot be present in a free form. It is an element which is only combined with another element. It also has chemical as well as physiological effects. The history of the discovery of fluoride element dates back over centuries. It was first discovered and proposed by a scientist named as Maggot. He demonstrated the effects of fluoride on the system of human body and the teeth. Mackay was a scientist who first noticed brownish colored stains on a particular area of people, and he named those stains as mottled enamel or Colorado stains, since he discovered these stains in the people residing in the area named as Colorado. So he named the stain as Colorado stains. Later on, these stains were also known as dental These stains represent a mottled look of enamel, and later on it was found that these stains are due to the high concentration of fluoride element in the waters of the Colorado Springs. So fluoride was identified as a culprit for the same in the year 1931 when it was discovered. Later on, other scientists like Trendley H. Dean contributed to the discovery of fluoride. He carried out a survey which was named as Shoe Leather Survey, in which he investigated various geographical areas and the people having the same type of stains in those geographical areas. So what he found that these people have distinct brownish discoloration of their teeth and the mottling of the enamel. He then inspected the level of fluoride in the water, the various water bodies and the various water supply of those places. Now he concluded various inferences by conducting a study on the same. He found that if the level of fluoride element was greater than 4 ppm in the waters, it led to discrete pitting of enamel or mottled enamel. Lower than 4 ppm, that is 2 to 3 ppm, will show diffused whitish decoloration of the enamel. And if the levels of fluoride are about 1 ppm, it will show a marked tendency of decreased incidence of dental caries in those patients. So this is how he came to the conclusion that high concentration of fluoride levels in water up to 1 ppm can reduce the caries incidence in a particular area or the people who are intaking that particular water. Now there are various modalities for systemic fluoridation, which will be described in the following slides. The various modalities are, but the first and the foremost and the most important one, which is a universally accepted modality for water fluoridation. Now, what is water fluoridation? It is the adjustment of fluoride level in water of a particular place or in the community water supply. So, it can be defined as the upward adjustment of the concentration of fluoride in public water supply in such a way that the concentration of fluoride ion in water will be consistently maintained up to 1 parts per million to prevent the dental caries with minimum possibility of causing dental fluorosis. So this is basically the adjustment of fluoride concentration in the community water supply. It was found by various studies that water fluoridation led to the remarkable reduction in the dental caries incidence up to 50 to 70%. So, water fluoridation, the history can be dated back to 1931 to 1942, when Trenley H. Dean and Mackay discovered in Colorado Springs fluoride concentration was high, and they again found that the element which is responsible for the mottling of enamel was fluoride. In 1942, a significant change took place, that it was discovered if the water content or if the fluoride content in water is about 1 ppm or 1 parts per million, then it will lead to the dramatic reduction in the caries incidence, and the caries incidence of that place people will be very low. So 1 ppm was described as a safe level for fluoride in water of the particular place. There was a study which was carried out in Grand Rapids by Dr. Mackay and Trenley Dean, who reported the same thing, that is 1 ppm of fluoride is required or adequate for an anti-caries effect. So, what are the various compounds or fluoride compounds which are used in water fluoridation? They can be either fluorspar, then sodium fluoride, silicofluoride, then sodium silicofluoride, and hydrofluorosilicic acid or ammonium silicofluoride. Now we can mind that all these compounds have the element of fluoride. Now we will be going into the details of each. Now what is fluorspar? Fluorspar is basically a mineral which is containing high values or high amounts of calcium fluoride. Calcium fluoride is a compound of fluoride, and after ionizing calcium fluoride, fluoride can be released in free form. It contains about 85 to 98% of calcium fluoride, and the normal consumption of calcium fluoride was found to be high in US, that is 50 lakhs tons per year. Now coming to the another compound, which is sodium fluoride. Sodium fluoride is a product of fluorspar, and it is a byproduct of hydrofluorosilicic acid. The sodium silicofluoride, it is also incorporated in hydrofluorosilicic acid. It is the most popular compound. It is a compound which is used in various fluoridation techniques, and it has a low cost, but the disadvantage is that it is highly corrosive because of the acid content, and the pH is very low. The hydrofluorosilicic acid is one of the most expensive compound than the sodium silicofluoride. And coming over to the ammonium silicofluoride, this is basically used in the places where disinfection is also needed, because it releases ammonia which will cause disinfection, and additionally it will also release fluoride which will help in the anti-caries activity. What are the various systems or the equipment which are used for water fluoridation? They comprise of a saturated system, a dry feeder system, then a solution feeder, a venturi fluoridated system, and a saturated suspension system. Now, the venturi fluoridation system is one of the small system which can be used up in a small setup. Then what is a saturated system? So what is a saturated system? Basically, in a saturated system, 4% of sodium fluoride or calcium fluoride is injected in water for the distribution purpose. Then, in a dry feeder system, we use silicon fluoride or sodium fluoride in a water basin or the water bath. 9. A solution feeder system. A solution feeder system basically comprises of hydrofluorosilicic acid, which is more expensive compound, and it is a more expensive way of water fluoridation. Here the water is given in volumetric form and the water is fluoridated. So there are various technical considerations for water fluoridation. They comprise of the maintenance of the control of the quality of fluoride which is added, the quality of water which is added. Various monitoring systems are set up for the particular quality and the quality of both the water as well as the fluoride, and the analysis of the same. So it comprises of the controls of the water treatment plants also. Basically, monitoring, maintenance and control are the technical considerations of water fluoridation. It is always dose dependent. The dose dependency was directly proportional. For example, if the fluoride concentration in water was high, it will lead to a higher incidence of dental fluorosis. At the fluoride level of 1 ppm, it was estimated that 12.5% of exposed people will have less fluoridation. But even the water fluoridation has particular advantages and disadvantages. So, the advantages of the same are that it can be supplied to a large population of people. It is a very cost-effective system, and since the water consumption of a particular society is high, it can be distributed in a widespread manner. Then it also does not require a very large setup. It will not lead to any further problems. So it is one of the least expensive method of fluoridation. And there is also consumption of water on regular basis, so the people will be exposed to the fluoride level regularly. But the certain disadvantages of the same are, in the case of the places where there is a scarcity of water or proper community water supply is not there, in such cases it will pose a problem. Then even there can be human rights interference. People with human rights may interfere with the availability of fluoride in water or addition of the same in water supply of the community. Then also the community water fluoridation will be requiring a larger setup. So these were the advantages and the disadvantages of water fluoridation. It was also found that the addition of fluoride with temperature can change, and there is a particular formula for the same, that is, it is the parts per million of fluoride will be equivalent to 3.4 divided by E, where E stands for the particular fluoride level at the temperature and for a particular body weight of a person. Now coming over to school water fluoridation. The school water fluoridation is another widespread method for water fluoridation, but here a particular age group of people are targeted, that is the school going children, who have the most priority because of their eruption status of those teeth. So because the teeth are erupting at that particular age, the exposure of fluoride will lead to greater caries resistance in such people. So, the particular age group is targeted in school water fluoridation. So, the school water fluoridation aims in age prime group of the patients, and the amount of fluoride which is present in the school water is generally 4 times than that of the community water supply. That is, the recommended levels are about 4.5 to 6.3 ppm of fluoride. It was first conducted in Virginia Islands in US in the year 1954, where 2.3 ppm of fluoride was added to water, and studies indicated that there was a 22% decrease in DMFT, or the decayed missing filled teeth indices, on those particular school-going children. Even if the fluoride level or the fluoridated water is administered to the children who have their permanent teeth erupted or all the permanent teeth erupted, the level of the effect of the fluoride on the caries activity will be lesser than those children who are having a primary or the mixed dentition, because the dentition is at a formative stage in those age groups. So there are also particular advantages and disadvantages of the school water fluoridation. That is, if the school water is easily available to the patients, but there are certain children who cannot go back to the school, or there are poor children also who cannot afford school, or few children are there who are not regular to a particular school due to any transfers, migration, or any illness. So in such cases, the fluoride level in water or fluoride level administration cannot be maintained constantly to those particular children. Sometimes there is also not a regular intake or regular intake of the quantity of the water level. We cannot monitor the quantity of the water level taken by those children. So the amount of water which is consumed by school children cannot be monitored over a period of time. But the various advantages of school water fluoridation is that it is very cost-effective technique and can be directed to the prime group or the prime concern of dental caries of a particular age group, that is school-going children, where the effects of fluoride will be maximum. Moreover, it leads to a decreased caries incidence in school-going children and later who will grow into adults with proper permanent teeth. So it is also a cost-effective method and requires a small setup. Basically, here we can use a Venturi system of the fluoridation of water. Now coming over to the salt fluoridation. It was first conducted in Switzerland in the year 1955. Later on, many countries like Moscow and Italy, Mexico, Hungary and Colombia also followed Switzerland in salt fluoridation. Basically, Switzerland was a place where there could not be proper community water fluoridation, so they resorted to salt fluoridation. Here, it was 90 milligram of fluoride was added per kg of salt, or 200 to 350 milligram of salt was also added. The salt or the fluoride which is present in the salt, it used to have both topical as well as systemic effect. So the salt fluoridation was done in Westby of Switzerland place. There were certain studies which were conducted by Erickson and Hellstrom for the effect of salt on the anti-caries activity, and it was found that there was a reduction in caries incidence. Even Steiner, he reported the karyostatic effect of the fluoride and the anti-caries effect. The salt also appears as a safe vehicle for administration of fluoride. Now there were certain factors which led for Switzerland to make the salt fluoridated. These factors were that the Switzerland had decentralized or lesser number of the water supplies, which were very small. There were uniformly a low level of fluorine in the water levels of Switzerland, and a centralized ownership of salt production plant was undertaken in Switzerland. The salt fluoridation was less cost effective than the water, and a substantial research was also conducted by various scientists on the same, and successful results were found in Colombia and Hungary for the same, that is salt fluoridation. So the basic compounds which were added for salt fluoridation were sodium or calcium fluoride. The sodium or calcium fluoride was mixed with the moist salt and tricalcium phosphate with the dry salt. Both were incorporated on the conveyor belt system. There were various studies, and scientists declared that there was a 39% reduction of the caries status in the salt fluoridation places. Now, there are certain advantages of salt fluoridation. In the places where the community water supply is not adequate, as in the case of water fluoridation, we can resort back to the salt fluoridation. And it is the choice of an individual to accept or to reject the particular fluoridated salted. And even non-fluoridated salts were available for the community, so as the people can choose between the two. It also was cost effective, and there were a number of studies which were conducted for proving the efficacy of the salt fluoridation. Now, the disadvantages of the salt fluoridation was that there are varying levels of salt which is consumed by different patients. Even in hypertensive patients, the salt is restricted. So again, we cannot monitor the level of the salt which is taken by the people. Even high concentration of salts may lead to hypertensive disorders. Now, there was another method or modality for the systemic fluoride administration, which was milk fluoridation, in which the fluoride can be added to either liquidated or in the powdered milk. The basic compounds which were used were sodium fluoride, calcium dimonofluorophosphate, and disodium silicofluoride. The World Health Organization in 1994 recommended that 1 milligram of fluoride should be taken per day by a patient or a person. The sodium fluoride, which is added to the milk, and should be in a fixed weight to volume ratio. The disodium monofluorophosphate should always be added to a pasteurized milk. So Ziegler was a scientist who was the first one to add salt or fluoride to the milk powder in the year 1940s. Then this milk fluoridation also targets the school-going children or the children group who are more prone to caries, and the effect of fluoride in children will be more than that if it is administered to the adults. The fluoride is also present in milk form in highly ionized state in the oral cavity, which will increase its availability to the environment of the oral cavity. It can also be retained for a longer time in the oral cavity in the milk form. So it has both the topical as well as the systemic effects. The effectiveness of milk fluoridation can be proved by various studies who reported that there was 40 to 50% of reduction of caries in particular places. Even the bioavailability of the milk in low concentration was present in the oral cavity, and the fluoride is present in ionized form, which will lead to remineralization of the demineralized surfaces of teeth. Even on biopsy, the amniotic cavity as well as the enamel had shown the presence of fluoride or the fluoride element after the milk fluoride administration. Now, the disadvantages of fluoridated milk are that it cannot be available freely to all the children. In few places, there is a scarcity of milk. So, it also has problems in the distribution and the supply. It is less cost effective, and even parents have to monitor a lot in the milk fluoridation. There are also technical difficulties, and definitely it causes a problem for the cost effectiveness. The absorption of fluoride in the case of milk fluoridation in system is lesser than that from the water. So there is a wide variation of the intake of milk in various geographical areas. So milk fluoridation was not as successful as the water fluoridation. There were even many in vitro studies which were conducted on the bacterial biofilms, which were reported that the streptococcus mutants level in the biofilm was lower when the patients or the children were administered with fluoridated milk. Now, another modality was the fluoridated juice, which was discovered by Kempler, and fluoride was first used in juice by Kempler. The juice acidity will also aid in the availability of fluoride to the enamel. It was reported that 1 mg of fluoride should be added to 100 mg of the juice for 28% reduction in the caries level. Even Zahalka conducted various studies for the effectivity of milk fluoridation, which were for the juice fluoridation. Then further, the recent discoveries are fluoride tablets or fluoride drops like Pediflor, Amflor. Now these fluoride tablets are administered from the 2 years age of children to 14 years. We can either chew or suck the tablet, and the recommended dose for the fluoride supplement should be only limited to only those children who have a high level of caries incidence or the drinking water contains lesser than 60% of fluoride. Generally, they are contraindicated with the milk or milk products. The particular age group of 0 to 24 months should not be taken the fluoride tablets. From 2 to 6 months or years, 0.25 mg per fluoride can be administered, and from 17 to 18 years, 0.5 mg per day can be administered in the form of fluoride lozenges. Now, what is defluoridation? It is the method of removing the naturally occurring fluoride from the drinking water so as to reduce the severity of fluorisis or the deleterious effect of the fluoride element. WHO recommended that the normal dose for fluoride in water can be 0.7 to 1.2 ppm, and the National Environment Engineering Institute in India, it has a plant for defluoridation. The defluoridation methods can be divided into 4 basic types depending upon the mode of action. First is a chemical reaction with fluoride, then it's the adsorption process, the ion exchange process, and other miscellaneous methods. So basically, coming to one of the most important technique is a Nalgonda technique for defluoridation. So Nalgonda technique is one of the most widely accepted method for defluoridation, and it was carried over in Nagpur by the National Engineering Research Institute. It comprises of the main compounds, that is sodium aluminate or lime and bleaching powder, and these are added in the water in the same sequence. That is, first we can add sodium aluminate, which is followed by the lime, which is further followed by bleaching powder. It not only clears off the fluoride level but also helps in the sanitation or proper disinfection of the water supply. So what is the method which will be divided into future steps. First is a rapid mix, in which the various contents are mixed rapidly, which will lead to the coagulation of various particles which are suspended in the solution. These will form a coagulant mass and will form microagglutinates or microflocs. The sodium aluminate which is present and the chemical which is added will aid in the formation of the microflocculation. Then comes the flocculation process. It will lead to the formation of the settlable particles or the sediments from the colloidal particles which are suspended in the solution. A gentle and a prolonged mixing is advocated in the flocculation process. After flocculation, the particles which are about to settle are sedimented. The gravitation method helps in sedimentation of the particles, and the supernatant water fluid is collected over them. There are various factors which will aid in the sedimentation process are the size and the shape and the nature of the particles, even the viscosity and the density, the surface flow rate and the depth of the setting zone will also determine the sedimentation process. After sedimentation, filtration is done, that is all the suspended particles are removed and the water, a supernatant liquid, is removed from the same. So what are the main features of Nalgonda technique? That it is a domestic process, can also be used as a domestic process, a small scale process, a large scale process. It cannot lead to the formation of caustic acids. So there is no handling of these acids, there is no regeneration of media, it is very cost effective, and according to the suit needs we can modify the process also, and the municipal water treatment is only required and it is a readily available method. It has a simple design, construction and operation, and even maintenance is simple. The local skilled persons can operate this technique, and it is highly efficient for the removal of fluoride and even the impurities in water. The color, the odor and the turbidity, even the bacteria can be removed from water by the following technique. Next, coming to the ion exchange method. In the ion exchange method, hydroxyl cycle or chlorine cycle is used and the ions are exchanged. Basically, there is a polystyrene ion exchange resin which is a basic quaternary ammonium compound which is added to remove the fluoride. Next is the adsorption process, that is, on the surface of a particular material, due to its porosity, the fluoride element is absorbed, but it is basically on the surface. The various materials used are the bone charcoal, the natural crushed bone, even the bone char or the activated carbon. Hydroxyapatite in the combination with tricalcium phosphate is also used. The activated magnesia will provide a porous medium for the adsorption of fluoride on the surface layer. Even activated alumina will aid in the fluoride adsorption. It is prepared by the dehydration of aluminium at the temperature of 300 to 6000 degrees centigrade. So the various advantages of the same are that the minimum contact time is required, even the percentage of regeneration of the products is lesser, a very little attritional loss or the loss of the byproducts is there, and there can be reutilization of all the products in the same procedure. It is very easily available, readily available, and is a cheap process. Even the defluoridation capacity at neutral pH is appreciable. It does not require a very low pH for activation and conduction. Even certain natural materials like umbilica, moringa, the roots, the leaves and the barks of the plants are used for defluoridation. Now, what is fluoride toxicity? The toxicity of fluoride can always be divided in either acute or chronic toxicity. It is due to the intake of high amounts of fluoride in any form. either in the acute form or in the chronic form, in little by little amounts, or accidental dosage of the fluoride. So there are certain levels which will be the lethal dose or the toxic dose and the safely tolerated dose. Now what is a safely tolerated dose? It is the amount of fluoride which can be tolerated by the patient without producing any adverse symptoms. It is between 18 to 16 milligram per kg of body weight. Now what is the toxic dose? If the toxic symptoms or adverse symptoms are manifested in the patients, it is known as the toxic dose, which is between above 16 milligram per kg of fluoride. Now there is another dose which is the lethal dose, which will lead to the fatality or the death of the patient. It is generally between 32 to 64 milligram per kg of body weight. So what are the various signs and symptoms of the acute toxicity? It is recommended that if the person takes more than 16 milligram of fluoride, then it will lead to acute toxicity or accidental contamination by the fluoride element. It was a study and it was a case which was reported in a hospital in Ohio, in which accidentally the patients took strangled eggs which were contaminated by sodium fluoride, because the eggs were prepared and in the case of salt they were confused as sodium fluoride, and sodium fluoride was added to the eggs, where if the patient took that particular food, they had lethal dose of fluoride, and half of the people were dead because of the same. So fluoride, it causes a block in the cellular metabolism. It also inhibits the enzymes which are responsible for various cellular activities, the transmission of nerve impulse, which will further lead to depression of the central nervous system. It will also interfere with various synapses and body functions because of the calcium channel will be blocked. The gastrointestinal effects will be nausea, vomiting, diarrhea, and the cramps, the abdominal cramps will be there, and there will be corrosion of the gastric mucosa because of the hydrofluoric acid. The neurological signs will be depression in the central nervous system, paresthesia, paresis, the tetany, and there will be lack of expansion of the muscles. Even it may lead to respiratory system arrest. The cardiovascular systems or the symptoms will be pallor and decreased cardiac output. Even it can lead to the patient in cardiac arrhythmias, irregularity of the heartbeat, and the cardiac failure. The blood will be subjected to ketoacidosis, hypoglycemia, and hypomagnesemia. The symptoms will be appeared in 1 to 2 hours, and the patient can be dead within 2 to 4 hours after injection. But if the patient is recovering after 24 hours, the prognosis of the patient will be good. Now, in the case of chronic toxicity, there will be effects on the skeletal system, the kidneys, as well as the dental system, which will lead to skeletal fluorosis and the dental fluorosis. The skeletal fluorosis, also known as osteofluorosis, it was found in the areas of people who worked in aluminium factories due to the inhalation of aluminium dust. It was prevalent in South Africa, China, and other temperate conditions, where the fluoride concentration of water was also more. Then avitaminosis, low protein level in diet, vitamin C deficiency, calcium deficiency will also promote the susceptibility of the fluoride toxicity. So what is osteoarthritis, in which the bone, there is a increased thickening of the bone, and the first stage will be generally asymptomatic. The density of bone will increase, the bone trabeculae will be rarefied, and the extremities will be thickened. They will be increased prone to the fractures. There will be periosteal growth, which will be irregular, and there will be calcification of tendons and ligaments. There will be also renal failure in the case of kidneys, and it can be treated by dialysis. Even the low level of fluoride will lead to hypothyroidism, which can also call cretism or decrease of intelligence of the offspring, and even coma, the high cholesterol level, depression and cardiac arrest. The dental signs will be fluorosis or the mottled enamel. Initially stages, there will be only specks of hypocalcification which will be present on the teeth. Later, these specks will be coagulated to form white strands, and which will further conglomerate and fuse together to form white flecks on the teeth, and finally which will lead to mottled enamel or brownish discoloration of the entire teeth, especially the mesoincisal angle. The final stage will be pitting of the enamel or the deformation of the enamel. Basically, fluoride, it inhibits the amelogenesis stage of the developing teeth. So, there will be effect on the enamel, the quality and the quantity of the enamel. Dean also gave an index of enamel fluorosis in which he divided into 0, which was questionable, 1, which is mild, 2, which is moderate, and 3, which is severe. So, systemic fluoridation has a anti-carious effects, but the fluoride is a double-ended sword. It will also lead to fluorosis in high levels, which is highly lethal too. Thank you.